When you turn 65, one of the most important decisions you'll ever make about your health is choosing between original Medicare and a Medicare Advantage plan. It's a choice that can affect not only your healthcare access, but also your financial comfort for years to come. And in 2025, there are new rules, new benefits, and new costs that make this decision even more critical. So, if you've ever wondered which one is truly better for you, Medicare Advantage or Original Medicare, stay right here. By the end of this video, you'll have the clarity you need to make a smart, confident decision for your future healthcare. Let's start with a simple but powerful question. What kind of healthcare do you really want in retirement? Do you prefer the freedom to see any doctor anywhere in the United States? Or would you rather have everything managed under one coordinated plan with some extra benefits like dental and vision? Both sound good, but the difference lies in how much you'll pay, how flexible you'll be, and how much peace of mind you'll actually have when you need care the most. Now, before we go deep, let's clear one big misunderstanding that confuses millions of Americans every year. Medicare Advantage is not a supplement to Original Medicare. It's an alternative. When you enroll in Medicare Advantage, you're essentially letting a private insurance company handle your Medicare benefits. The federal government pays that company to manage your coverage, and that company decides how your care is delivered, which doctors you can see, and what your out-of-pocket costs look like. Original Medicare, on the other hand, is run directly by the federal government. It's made up of Part A for hospital care and Part B for doctor visits and outpatient care. You can see any doctor or specialist anywhere in the country, as long as they accept Medicare. There are no networks, no referrals, and no need to ask for permission to get certain procedures done. That's one reason why many seniors still prefer Original Medicare. It's simple, predictable, and nationwide. But of course, there's a catch. Original Medicare doesn't cover everything. You'll have to pay 20% of the cost for most doctor visits and medical procedures, and there's no limit to how high those bills can go in a single year. That's where a Medicare supplement plan, also known as Medigap, usually comes in. Medigap helps cover those gaps, reducing your out-of-pocket costs. The combination of Original Medicare plus a Medigap plan can give you very broad coverage and flexibility. But you'll pay a monthly premium for that Medigap plan, and you'll also need a separate Part D plan for prescription drugs. Now, let's look at the other side. Medicare Advantage, or Part C. These plans combine your Part A, Part B, and usually Part D drug coverage all into one plan. Many also include extra benefits like dental, vision, hearing, fitness memberships, and sometimes even grocery or transportation assistance. And here's the part that grabs attention. Many Medicare Advantage plans have $0 premiums. Sounds great, right? But let's slow down for a second. While the monthly premium might be low, the trade-off often comes in the form of higher copays, limited doctor networks, and prior authorization requirements. So, if you like having everything in one place and don't mind staying within a network, Medicare Advantage can be a great fit. But if you travel often, spend part of the year in another state, or simply want the freedom to see any doctor, Original Medicare with a Medigap plan might be the better path. Let's bring this to life with a real example. Imagine Susan, a 67-year-old retired teacher. She's healthy, active, and loves to travel across the country to visit her grandkids. For her, Original Medicare with a Medigap Plan G is perfect. She pays a predictable monthly premium, but she never worries about whether a doctor accepts her insurance or if she's out of network. Now, let's meet John, a 70-year-old retired engineer. He lives in one city year-round, has a local doctor he trusts, and wants to keep costs low month to month. John chose a Medicare Advantage HMO plan. He pays little or nothing for premiums, gets his prescriptions covered, and enjoys dental and vision benefits for him. That trade-off works perfectly. This is where the key insight lies. Neither plan is universally better. The right choice depends on your lifestyle, your health needs, and your financial comfort zone. But in 2025, there are a few new rules you need to know before making your choice. First, starting in 2025, the Inflation Reduction Act introduces a $2,000 annual cap on out-of-pocket drug costs for all Medicare drug plans. That means if you take several prescriptions, you'll pay no more than $2,000 per year for your medications, whether you're in original Medicare with Part D or a Medicare Advantage plan with drug coverage. This is a big win for seniors and will especially benefit those with high medication expenses. Second, more Medicare Advantage plans are expanding their extra benefits for chronic conditions. These include coverage for transportation to medical appointments, meals after hospital stays, and even home-based care support. Some plans are tailoring their benefits to help people with diabetes, heart conditions, and mobility challenges live more comfortably at home. However, the trade-offs remain. According to recent data, about 40% of Medicare Advantage enrollees faced prior authorization denials or delays in 2024. That means even if a doctor recommends a certain test or treatment, you might have to wait for the plan's approval, something you'll rarely face under original Medicare. So ask yourself, how much control do you want over your healthcare decisions? If you prefer a hands-off coordinated plan where everything runs through one company, Medicare Advantage can feel smooth and simple. But if you value independence, national access, and fewer administrative hurdles, original Medicare still holds the edge. At this point, you might be wondering, what about costs overall? It's not just about monthly premiums, it's about the total yearly cost, including copays, deductibles, and the unexpected. With Medicare Advantage, your maximum out-of-pocket limit in 2025 can be up to $8,850 for in-network services. Though some plans set it lower, once you hit that limit, the plan covers 100% of your approved costs for the rest of the year. In original Medicare, there's no out-of-pocket limit, but if you have a good Medigap policy, it can virtually eliminate those extra expenses. Here's a quick truth many people overlook. If you start with Medicare Advantage and later decide you want to switch to original Medicare and get a Medigap plan, you might face medical underwriting. That means insurance companies can look at your health history, and they might charge you more or even deny coverage. That's why your first choice at age 65 is so important. It sets the tone for your healthcare future. Now, let's pause for a second. If you're finding this explanation helpful, don't forget to subscribe to Medicare Mentor. Every week, we break down complex Medicare topics into simple, understandable advice you can actually use. It's free, and it could save you hundreds or even thousands of dollars in healthcare costs. Back to our main discussion. Another difference between the two paths is how emergencies and travel are handled. With original Medicare, you're covered anywhere in the U.S. as long as the provider accepts Medicare. With Medicare Advantage, coverage outside your service area is limited, except for emergencies. So, if you spend winters in Florida and summers in Michigan, a national coverage option like original Medicare may give you better flexibility. It's also worth considering how each option handles care coordination. Medicare Advantage plans are built on managed care models like HMOs and PPOs. In an HMO, you usually need to select a primary care doctor and get referrals for specialists. In a PPO, you can see out-of-network providers, but you'll pay more. Original Medicare, by contrast, doesn't require referrals at all. You decide who you want to see and when. Now let's talk briefly about quality. Both types of coverage must follow federal standards, but the experience can vary widely. Medicare Advantage plans are rated from 1 to 5 stars based on quality and member satisfaction. Choosing a plan with at least 4 stars can make a real difference in how smooth your care experience is. In contrast, original Medicare's quality depends mostly on the doctors and facilities you choose, giving you full control but also more responsibility to find high-quality providers. You may also hear about something called Medicare Advantage Special Needs Plans. These are tailored plans for people with certain chronic illnesses, those in nursing homes, or people who qualify for both Medicare and Medicaid. They can be extremely beneficial if you fit into those categories, offering personalized care management and cost help. The decision between these two paths also touches your peace of mind. Some seniors feel reassured by the structured, all-in-one simplicity of Medicare Advantage. Others feel more at ease knowing they can go anywhere, anytime with original Medicare. There's no right or wrong answer here, just what's right for you. Here's a useful way to think about it. If you're healthy, don't travel much, and want convenience, Medicare Advantage might be your best choice. If you have ongoing health issues, value national coverage, and want predictable out-of-pocket costs, Original Medicare with Medigap could be worth the extra monthly cost. And remember, Medicare is not a one-time decision. Every year from October 15th to December 7th, you can review and change your plan during the annual enrollment period. That means if your needs change, your plan can change with you. The key is to stay informed, review your coverage, and make sure your plan still fits your life. Before we wrap up, let's circle back to something important. The goal of Medicare isn't just to cover you. It's to give you access to care when you need it most without financial stress or confusion. That's what we focus on here at Medicare Mentor, helping you navigate these choices clearly and confidently. So, if you found this video helpful, take a moment right now to subscribe and turn on notifications. In our next video, we'll break down exactly how to compare plans side by side for 2025, using real-world examples that show which plans give you the most value for your money. Don't miss it, because just one smart Medicare decision can make a huge difference in your health and savings for years to come. Until next time, this is your Medicare Mentor, guiding you towards smarter, simpler, and more affordable healthcare choices. Stay informed, stay healthy, and remember, the best Medicare plan is the one that fits your life, not someone else's.